Hello everyone, I'm Gerald Teh Beng Hock. I'm a Gynaecological Oncologist here in Gleneagles Hospital, Kuala Lumpur. A gynaecological oncologist is a doctor who treats cancer and precancer of the female reproductive tract. The female reproductive tract includes the cervix, the uterus, which is commonly called the womb, ovaries, and less commonly in this part of the world, diseases of the vulva and vagina. Gynaecological oncologists are a group of subspecialists in the field of obstetrics and gynecology who are specially trained to treat cancer and precancer lesions of the female reproductive tract. We are also trained to perform surgeries from the simple gynecological surgeries to complex, difficult surgeries which involves cancer and also recurrent diseases such as endometriosis. These are challenging surgeries which usually involves surrounding structures such as the bladder, rectum, and the urinary tract. Because the female reproductive tract is situated deep in the pelvic cavity, one can present with a myriad of symptoms. Common daily symptoms such as pain, uneasiness, abdominal distension, bloatedness can be easily brushed aside or ignored. Most specific symptoms such as abnormal periods, heavy periods, or bleeding after intercourse can be worrying symptoms. Unexplained loss of weight or loss of appetite, change in urinary as well as bowel habits needs focus as well as special attention. You should consult your gynecological oncologist if you have the symptoms mentioned earlier, or if your symptoms have changed in intensity or pattern, as well as if you are simply uncertain of what you have. You can just consult and get an opinion. There is a special group of population which also needs to be focused on, and these are those with personal history of breast cancer as well as colorectal cancer, or those with family history of these cancers, because they are more prone or more at risk of getting gynecological cancers. So when you visit a gynecological oncologist, what we usually do is take a thorough history, and this history would include your personal history, social history, family history, as well as your reproductive and gynecological history. Following that, we would do a thorough examination, and this would include examination of the abdomen or the tummy, as well as a pelvic examination. The pelvic examination is almost always painless, but at times it can be quite discomforting. You should not be embarrassed or feel ashamed when we are conducting this examination, because you are always in the presence of a female chaperone. This will usually be followed by a bedside ultrasound, and ultrasound can be done either through the abdomen or transvaginally. This is to assess the disease or the lesions involving the female reproductive tract. At this juncture, we will be able to tell you that what you are experiencing or what we have found is either normal or physiological, or abnormal and potentially cancerous. Following this, further tests can be done, and this includes a pap smear, blood test which includes cancer markers, as well as further imaging which includes CT scan, MRIs, as well as a PET CT scan. In conclusion, most gynecological cancers can be detected early and prevented, and if it is treated promptly, you would have excellent prognosis and a very high curative rate. So make a consult or a visit to a gynecological oncologist if you have worrying symptoms, but it is also important to remember some cancers are asymptomatic, meaning there are no symptoms. So if you are perfectly well without any symptoms, you should also have periodic health checkups to ensure that you are in good health. So talk to us about prevention of cancer, such as specific screening tests as well as vaccination. We are here to allay your anxieties and concerns to make sure that you are in the best of health.